Hi everyone, Dr. Remy from Pain Free and Fit and Posture Size. Today we've got a great video in response to one of our subscribers' questions, Donna, who has spondylolisthesis pain early in the morning. This is a video that will show you early morning mobilization exercises that can be done in bed to help get that pain and stiffness out before you get your day going. Hope you enjoy. So we wake up with stiffness and pain in the morning, we're still in bed, our spondylolisthesis lower back pain is starting to kill us. What do we do to help before we even get our day started? First, remember that you need to have an idea of what your unique mechanics and postural issues are, because this is going to affect how you're going to do these exercises. If you have not yet done so, go to either the Pain Free and Fit or Posture Size websites, take our free body analysis and learn what your unique mechanical issues are and postural issues that are affecting your lower back and your spondylolisthesis, so you can use those to help stimulate your body's healing mechanism in the correct way. With that being said, I wake up in the morning, we're going to go through 3 basic motions for the spine to help mobilize the spine, loosen up tight tissues which tighten overnight, because when we're not moving tissue, especially those tissues with chronic inflammation and pain where the neurological system is guarding it, have a tendency to tighten up over the night. So we're going to be doing these mobilization exercises which aren't far enough to really stretch things out, but just small motions about 1/4 of an inch to 1/8 of an inch to stimulate a little motion, get a little circulation going in the soft tissues, help to stimulate some receptors, nerve receptors that pick up motion, that have a pain dampening effect in the central nervous system, and help to get the soft tissues which have become stiff to start gliding over each other, the fibers, and provide some motion to make us feel better. So we're going to begin by engaging our RPI, which is our reverse posture isometric, the opposite positions of your postural tendencies, and we're going to engage any mechanical problems such as multifidus muscles that are weak. We're going to correct, we're going to put that tension on. We're going to engage our lower abdominal muscles. If we have an internal oblique situation that's firing too much, we're going to pull our lower abdomen in slower and deeper on that side. And we're going to try to position our legs in a straight fashion so one is not turning out more than another. The first motion we're going to do as we maintain a neutral spine, now remember that is a spinal position, especially with your spondylolisthesis, that's not painful. It's in the middle of motions. So when you first wake up in the morning, to determine what that neutral spine is, you can tilt your tailbone slightly under. That'll flatten your lower back. And go as far as you can till you feel a little pull or a little ache or a little discomfort. Stop there, that's one limit. And then if you tilt your tailbone up towards your shoulder blades and your pubic bone down towards your knees, you'll increase the arch of your lower back. And most people with spondylolisthesis will only have to go very slightly in this motion before they start to feel some discomfort or aggravation. Those 2 extremes of motion, tail under where it starts to aggravate your symptoms and tail up, those are the 2 limits of motion. We want to put our neutral spine position right in between those 2 areas. So if we had pain at, let's say, 2 inches of going under with our tail and pain with 1/2 inch coming up, we want to go right between those 2 areas and hold that position for a moment. We want to visualize the spondylolisthesis or anterolisthesis, in this case vertebra, that slipped forward in our spine. We're going to visualize a tension that holds that back in place. When you visualize these things mentally, your brain is the captain of your central nervous system. There are going to be motor impulses that come down your spinal cord through your peripheral nerves into those muscles and actually help hold your vertebra in that position if you strongly visualize it. From there, we're going to mobilize. We're going to tilt tail under no more than 1/4 of an inch. Now remember, you're in your neutral spine position, so you can go an extra 1/4 of an inch without pain. You had that limit further down. And then after 2 seconds, we're going to slowly roll the tail up, but this time only 1/8 of an inch. Still staying near that center point, only going a little bit past it, not far enough to cause symptoms. And we're going to cycle back and forth, tail under holding for 2 seconds, and tail up for 2 seconds. And we can cycle back and forth 5 to 12 repetitions, holding each one for 2 seconds. Again, we're not trying to go as far as it takes to feel pain or create a stretch. We're simply moving in a pain-free range of motion to stimulate motion, nerve receptors, and get fluids going in there for circulation. So the next motion we're going to do is we're going to place one hip down. Now that's like lengthening your leg through your foot. That's going to take one side of your pelvis and push it long and bring the other side up towards your ribs. Again, there'll be a pain-free range of motion, a neutral spine. At a certain point of going down, you may feel a pulling in your back. That's too far, that's one limit. If you push the other leg down, you'll find a limit. You want to be between those two limits with your spine, and then just work maybe 1/4 of an inch into the less painful direction. Hold for 2 seconds. And if you're going into a painful direction, you'll shift the other leg down, creating that hip to go down and the opposite hip to come up. Only 1/8 of an inch. Remember, we're using 1/8 of an inch motion into the directions that are more painful. 1/4 of an inch, no more than 1/4 of an inch motion into those directions that are less painful. So it's a very tiny motion, cycling back and forth, holding for 2 seconds each. Again, anywhere from 5 to 12 repetitions. You don't need more than that. The next one we're going to do is a little spinal rotation. Again, with the knees bent. You could have the legs straight with this one also, but I'll show this with the knees bent. We're going to allow our knees to fall to one side, just a little bit. If you go a certain point, you're going to feel a little irritation to your back, a little pulling. Stop there. Remember what that limit is. Rotate the other way. You're going to feel a little limitation. That may be an opposite direction to what your hip is used to doing. For instance, if you normally stand with your leg turning out in external rotation posture, this direction where I'm letting my knees fall to the right is stretching it, so that may be a little tighter. Tightness isn't the big issue here, it's where we start to feel discomfort. So if we have any discomfort, any pulling that's irritating to us, that's the limit that we want to stop at. Again, we've determined a pain-free range and rotation from left to right. We want to center our spines and our hips right in the middle of that. That's a neutral position. Again, engaging all our RPI muscle tensions that we've learned from our analysis that's unique to our body. And we're going to rotate the knees about 1/4 of an inch and allow our spines to move 1/4 of an inch into that less painful direction. Hold for 2 seconds and then rotate the opposite way towards that side that's a little more painful. We'll only go maybe 1/8 of an inch, allowing our spines to rotate there. So we're holding our spine very close to that neutral position, but because of muscle tensions and visualizing that spondylolisthesis moving backwards, we're allowing a slight motion, but it's controlled and guarded so things don't become irritated, but simply mobilized and starting to move back and forth for those mobilizations. We can also stimulate the hip in a certain maneuver that's very good for most spondylolisthesis cases, because many people with spondylolisthesis have a tendency to have an anterior pelvic tilt where their tailbone is higher than their pubic bone when they stand up, and that increases the arch in our lower back. So as a result of that, the hip flexors, the muscles that pull our leg forward, become much tighter, and the hip extensors, like the glute max, the main buttock muscle, become weaker. And this is a big mechanical insult on the lower back, because during walking and movement, because of dominant hip flexors and weak glutes or buttock muscles, the low back muscles, particularly the erector spinae, become overactive, and they can cause an increased arch in the back as they contract. And that generally jams the facet joints, the back of the disc down, pinches the synovial linings of the involved joints of our spondylolisthesis and causes pain. So this exercise helps to retrain the hip and the hip joint first thing in the morning. So when you start to get out of bed and move, your hip flexors have already decreased their activity and you've waked up the glute max a little bit. You've woken it up, that buttock muscle, neurologically to make it stimulate and hold the hip in the right position, freeing the excessive tension on the erector spinae muscles in the lower back. So the way you do this is you can bend your knees just a little tiny bit to a comfortable position, and you're going to feel the side of your hip where the hardest aspect of the hip is. That's called the greater trochanter. It's about a golf ball size or a little bit bigger, and you can feel if you travel down the side of your leg and come up towards your hip, there's going to be a hard ball there. You're going to take your fingers and put one finger in front of that hard ball and one finger behind that hard ball. And you're going to focus on having that hard ball move backwards in your body, backwards into that bottom finger, as you try to lift your toes and bend your knees slightly towards your chest. It's a very slight motion. And what that's doing is it's activating the glute muscle, the buttock, that attaches to that greater trochanter and driving it backwards and releasing the pressure of the hip flexors. And you'll feel a softening under your front finger. Those hip flexor muscles in front of the greater trochanter will start to soften, and there'll be a hardness or a tension increasing on your back finger. And again, you can hold that for 2 seconds each, or this particular exercise you can hold up to 5 seconds if you want to, And you'll do about 5 to 12 repetitions of just bending your forefoot up while the heel stays down, and you'll notice my knee moves slightly up towards my chest, and that's waking up that glute max muscle. After I do these mobilization exercises, I hold my core, the same core tensions or RPI tensions that I've held throughout the exercises. I roll to my side, moving my whole body from my nose down through my pubic bone as one unit so that my shoulders don't move past my hips, and I come up out of bed into a seated and then eventually a standing position. So that's a nice little mobilization series to start neurologically waking up the proper muscles, providing motion, taking soft tissues that have tightened overnight due to damage, due to neurological guarding, due to chronic inflammation, and starting to move them while stimulating sensory nerves to help dampen the pain effects. Use this on a daily basis if you have pain early in the morning with spondylolisthesis, and give me a comment back, let me know how it works. If you'd like to help me share this information with others that have spondylolisthesis, give me a thumbs up below. Any questions or comments, I'd love to entertain. That's how we make our videos. Besides teaching, we like to answer questions so that your questions, your particular troubles can be answered on these videos. I encourage you to visit our website, painfreeandfit.com. We've got a lot more exercises for spondylolisthesis, as well as our new Fast Track Healing program that's coming out in July for spondylolisthesis. And I hope this exercise helps with your early morning spondylolisthesis pain.